Oral candidiasis is an opportunistic infectious disease primarily caused by Candida albicans, a type of yeast that is normal to the human microbiota, primarily in the mouth, throat, gut, and vagina, but can cause infections in cases of overgrowth. Candida albicans can cause candidiasis if there is a disruption of the normal microbiota. People receiving chemotherapy or radiation treatment for cancer, those with HIV/AIDS infection, individuals undergoing tissue or organ transplants, patients experiencing dry mouth due to disease, aging, or as a side effect of drug therapy, those wearing dentures, and patients taking steroids and/or antibiotics are all at risk. Candida albicans belongs to the domain of Eukarya, kingdom of fungi, and phylum of Ascomycota. Candida albicans primarily reproduces asexually through a process called budding. In budding, a new daughter cell forms as a small outgrowth or bud on the parent cell, gradually enlarges, and eventually separates to become an independent yeast cell. Additionally, it has the unique ability to undergo phenotypic switching, which means it can change based on its environment and can exist in different forms, including yeast, pseudohyphae, and hyphae. Candida albicans can also reproduce sexually, although it's not that common. White cells first switch to a mating competent opaque form, and then initiates pheromone signaling with cells of the opposite mating type. Mating projections then extend and fuse, forming a mating zygote. This leads to the formation of a tetraploid nucleus. The tetraploid nucleus then replicates with one tetraploid nucleus moving into the budding daughter cell. The cells then continue to replicate and bud. Oral candidiasis can be transmitted through direct contact such as kissing, but it is uncommon for people with healthy immune systems. Infants can also contract it by breastfeeding from breast with thrush on them. As for the effects on the body, oral candidiasis can manifest itself in a few different ways, such as acute pseudomembrane candidiasis. This is the most common form, especially seen on newborns and immunocompromised individuals. It shows up as white patches on the mouth lining that can easily be wiped away. Also, it can show up as atrophic candidiasis, which usually appears as red patches, often after antibiotic use, where patients may feel a burning sensation in the mouth. Also, in more severe cases, it can manifest itself as hyperplastic candidiasis. In this case, it presents itself as white plaques that cannot be removed. It's linked to smoking and it may carry the risk of developing into a precancerous condition. On top of that, it can also include chronic atrophic candidiasis, also known as denture stomatitis. This form shows redness under the dentures, and it's often painless, but it can cause discomfort in some cases. Treatment includes topical antifungal therapies such as azolas and polines. These are usually the first line of treatment. However, in the case of systemic severity, antifungal therapy includes triazoles like fluconazole. There are plenty of preventative actions you can take, such as keeping good oral hygiene, checking your dentures, managing your sugar intake because sugar can encourage the growth of candida, and making sure you treat any other conditions you have, such as a dry mouth. But I wouldn't be so quick to judge people with this condition because preventing it's easier said than done in some cases. As I said, it can develop in patients who have had recent transplants or other infections, sometimes things that are just out of their control. While oral candidiasis itself doesn't really have outbreaks, it can be linked to pandemic outbreaks such as the recent COVID-19, in which many people's immune system became weakened and there was a rise of corticosteroid usage. Hey Siri, how do I say Ascomycota? Am I pronouncing it right? Which language?